If you've worked in the operating room for any length of time, then you have probably seen a Cobb elevator or a Cobb retractor and have probably used it in multiple cases. But do you know where we got it or who invented it? Dr. John Robert Cobb was born in Brooklyn, New York in 1903. In 1925, he graduated from Brown University with a degree in English literature. While he was in school, he was an exceptional athlete. He was involved in swimming, wrestling, and cross country. And he also worked as a lifeguard, which is what piqued his interest in a medical career. After graduation from Brown, he enrolled in a post-baccalaureate biological sciences program at Harvard, and after just 1 year was accepted in the Yale School of Medicine class of 1930. After graduation, Dr. Cobb was a surgical intern at New Haven Hospital in Connecticut, and he later completed an orthopedic surgery residency, which he pursued because of a deep interest in biomechanics. In 1934, Dr. Cobb moved to New York City and took on a pivotal role at the Hospital for the Ruptured and Crippled, which is now known as the Hospital for Special Surgery. Besides clinical care and teaching and research, he was tasked with building a dedicated clinic for treating children with scoliosis. And scoliosis was something that was very poorly understood at the time, but his careful work in spine care permanently changed how we measure and treat spinal deformities. As Dr. Cobb reviewed x-rays and clinical outcomes and long-term follow-up of his patients, he recognized the need for a reliable way to quantify spinal curvature. With that in mind, in 1948, he published and popularized what we now call the Cobb angle, a method for measuring the degree of spinal curvature on a radiograph. He drew lines on the top end plate of the most tilted vertebra at the top of the curve and on the lower end plate of the most tilted vertebra at the bottom, then measured the angle between them. This simple but standardized measure gave clinicians a much better way to decide when bracing or surgery was needed for their patients. But Dr. Cobb didn't stop there. In the operating room, treating spinal deformities required sufficient exposure, clean dissection, and good control. To support this, he developed his own surgical instrument, the Cobb Elevator, or the Cobb Retractor Periosteal Elevator. This instrument was designed to assist in spinal exposures, periosteal elevation, and bone graft preparation. So thanks to Dr. Cobb, the measurement of certain spinal curves became consistent and reproducible, surgical exposure in spine surgery became more refined, and treatment decisions for scoliosis acquired an objective foundation. So today, when a physician measures a scoliosis curve in degrees using the Cobb angle, when you lay out a Cobb elevator on your back table or on your Mayo stand, or when a surgeon asks for that instrument to help them gain sufficient exposure and to have better control during their procedure, all of these actions can be traced back to the research and the innovation of Dr. John Robert Cobb.